also are temp checking at the door. That's actually both for staff and donors as well. Anyone who comes into our building is getting their temperature checked first. We're operating on an appointments preferred schedule right now, so we really want you to make those appointments so that we can be prepared for the kind of crowd that we may or may not see that day. Walk-ins will be accepted as capacity safely allows. We're maintaining social distancing, beds are 6 feet apart, and of course, employing extra disinfecting protocols that we're in the healthcare industry, so we were already pretty clean to begin with, but we are definitely diligently cleaning anything that a donor touches right after they leave.
Well, and you have to be clean because that blood goes from one person into somebody else, and that blood has to be clean. And so the community blood center has to be one of the cleanest places there are. So Chelsea, yeah. I'm 60 years old. Am I too old to give blood? Are my red cells just too darn fragile because I'm 60?
No, we actually don't have an upper age limit on blood donation. We do recommend that if you're, on medications or you have underlying health conditions that you would consult your doctor before donating blood. But as long as you're a 16-year-old definitely give our medical team a call.
How long does it take?
What was that?
How long does it take to give blood? If I come in and give blood, how long will I be there?
An hour or less. We usually say 45 minutes to an hour. Right now, we're definitely going to get you in and out pretty quickly because our donor centers are not busy. So we usually say from the second that you walk in when we're temp checking you to the time when you're eating cookies after you've donated and walking out the door, it's about 45 minutes to an hour.
All right. Saturdays and Sundays, are you all open?
We are, yeah. So we have blood drives throughout the community on random days. If you're looking for a list of those, we encourage you to look online at savealifenow.org. However, our 7 donor centers are open 7 days a week, and that's all across the community, all 7 of our donor centers. We need people to come to our centers. The blood drives are a big deal right now. We're finding large venues where it's safe for us to go in and collect. So as you can see, KU Med, we're going to be there next week, Wednesday, Thursday, and Friday from 7 to 5. And then we've got a host of other blood drives, Hy-Vee, Stony Creek Hotel and Independence, the Sports Pavilion in Lawrence. We've got a lot of large venue blood drives coming up, but those blood drives are not enough to help sustain our blood supply, so we really need to start increasing our traffic into our donor centers. That's actually one thing that we before COVID, we were collecting 70% of our blood supply on blood drives. That's not our reality anymore, and it probably won't be our reality for the remainder of the year or longer. We may never get back to 70% of our collections being on blood drives. So it's sort of a behavior change that we're asking of donors right now. We wish we could come to you. We wish we could make it as easy as we possibly can, but we're very limited, in the places that we're allowed to go right now. So our 7 donor centers are reliable. They're always going to be there, and they're going to be open 7 days a week. So definitely encourage donors to try and come into a center if they can.
All right. Well, Rock Chalk Jayhawk, MIZZOU. Let's go, K-State. We all need your blood. Help us out because this is a really big deal. Doc Hawk, how are we doing this morning?
Hi, we're good. We have 19 in the hospital. I think it was the same as yesterday. 7 in the ICU with 6 on the ventilator. We knew we had 6 yesterday in the ICU and 12 on the regular floors. We did have 3 COVID discharges, which is a good thing, but unfortunately, as our numbers are the same, we obviously did get some admissions.
I think we had a lot of routine screenings come back positive yesterday. So that's a little bit of an interesting a change. Mark, how are things over at Truman?
Steve, things are good here. We've seen a slight tick up in cases and currently have 14 patients in the hospital, 6 in the ICU and 1 on a ventilator. We've also discharged quite a few folks, I think 81 to date, and now we've tested more than 14,000 folks, mostly in our drive-through testing stations. And like everyone else, we're open for business and people are starting to return for their appointments. We still have about 20% of our clinic patients visiting us via telehealth. We weren't doing much of that prior to COVID, and now many of our patients who've gotten a taste of it actually prefer to see their doctor online rather than in person. And like others, we've just recently moved to allowing 1 visitor at a time on our inpatient units. We continue to be very involved in the community testing. This week, we've been at the Westside Can Center and Second Baptist Church in KCMO, Metro Christian Fellowship Church in Grandview, and Connection Point Church in Raytown. What's also keeping us equally busy these days are the requests for corporate and organizational testing we've received. Businesses around the Metro are reaching out to us, those who have a positive employee and want others tested, and those who are sending people back to work and want to take that extra precaution before they return. And we're providing this testing in different ways for these organizations. In some cases, we go to the businesses to do the testing on site, or the businesses send their employees to our on-site testing stations, or some organizations are using other professional personnel to obtain the samples and then sending those to us to do the testing. We're also providing asymptomatic testing of individuals whose workplaces are requiring tests before they return to work. And so if someone's interested in corporate or individual asymptomatic testing, they can obtain more information at our website, truemed.org. So that's kind of what's going on here.
Well, Mark, and thanks for joining this morning. You guys have done a great job with your community testing, those drive-through pop-up testing stations, and great to hear you're in Raytown and all these different churches. That's really an important thing to get to where folks are and to get folks tested. Larry, how are things over at Advent?
Well, good morning, Steve. Things are going well here at Advent Health. Our volume for hospitalizations for COVID patients, similarly to I think to Mark's, has taken a little bump in the last, or similar to yours, has taken a little bump in the last 5 days. But prior to this past weekend, we'd been stable with 9 to 12 patients a day for almost 7 weeks. The last 5 days, we've been averaging around 15 to 16 patients a day. Certainly not a huge increase, but it does not look like, and it doesn't look like it's linearly increasing, but it's certainly something to keep our eye on. On a little more positive note, we've tested over 2,500 asymptomatic patients prior to either their scheduled procedure or surgery, and we found only 7 positives in that entire group, which is less than 3%.
That's really low. Yeah.
Really low. In addition, even with our symptomatic patients that we've been testing over the last several weeks, we've only found about a 5% positivity. So those numbers, at least to me, indicate that maybe we still have a low prevalence of the disease in this population of patients. I'm certainly hoping so. We're encouraged by the fact that our ED visits and our outpatient clinics visits are starting to increase. I think it indicates a little less of a reluctance to seek medical care. Our volumes in those two areas are somewhere around 80% of our normal currently and slowly increasing. I do hope this means that people are not delaying their medical care that they need because they have a fear of returning. We certainly are doing everything we can to keep our patients and staff safe. We're screening all of our staff and visitors with a temperature screen and a few simple questions as they enter the facilities. We're providing masks for everyone, including patients that can tolerate them. We're offering mobile registrations for outpatient services and have limited numbers in our waiting areas to accommodate social distancing. We also are limiting our visitors to 1 per patient with still no visitors in some COVID positive areas. And I certainly would add on to the plea that we get people out to donate blood. We had a blood drive here at Advent Health recently, and I volunteered and donated my blood. So I want to encourage everybody else too. That it's a scary thing when we get to blood supply as low as we are. But otherwise, things are going very well.
Yeah, that's great. And I'm with you about that plea, obviously, for the blood. So, Dr. Adiga, how are things in Liberty? And by the way, if I lose Hawkeye today while he's traveling out in western Kansas, you're my ID, Doc, just to let you know that for the rest of the show. Sorry.
Okay. Well, as you know, here in the Northland, we had been relatively stable over a long period of time, but just as our operations are normalizing over the past week or two, we've seen a bit of a spike in the positive cases. And currently we have 6 in-house with 1 in ICU. We've ranged anywhere between 6 to 8 over the past week or 10 days. And we've discharged a few as well. And vast majority of these have been coming from the senior living facilities around us, and that had been my concern all along, that we're going to start seeing an influx of patients from there, and there are a few coming from the community as well. In terms of what else we are doing, you know, we had this drive-through clinic that we had set up a little while ago, and they've been working pretty hard, not only within our system. We, just like what Mark mentioned, we did offer some of these services to the businesses around us, including Ford and a few independent endoscopy centers and things like that. And we've been running some of those tests as well. Interestingly, Clay County also has the drive-through clinic that they offer asymptomatic testing as well. And their numbers, they had, this includes both asymptomatic and symptomatic. They had about 2.2% positive for a little while, but in the last week, I've noticed that number keep going up. It's been about 2.7%. So there is a little bit of a concern that I have that in the community, since we opened up, there is a little bit of a surge. I don't know if I can call it a surge, but an increase in the numbers, as well as you mentioned, you know, asymptomatic testing is showing a few positives. Other than that, I think we are doing well. I echo everybody else's opinion regarding the need to donate blood. We personally at this hospital, we have not faced a shortage issue quite yet, but you know, as we opened up, we are seeing increase in trauma cases, ATV accidents, motor vehicle accidents, and then of course surgeries are up, and there is an increased need for blood. So we will be pushing hard on our end as well to encourage blood drives and blood donations. But beyond that, I think we are doing reasonably well.
Well, I think our trauma guys are like you, or like the news you just delivered there about the trauma. Things were a little quiet for them for a while, but I do think as summer's picked up and people are starting to drive again, that's not necessarily the case now. So, you know, I just one quick comment. I was listening on the radio on the way in and on NPR, and they're interviewing some folks from Alabama where the percent positivity is up to 14%. That's a little spooky. Guys, Hawk, Dr. Adiga, anybody else jump in. What do you think about that rise to 14%?
Yeah, I don't know what exactly is the population that they're testing there, but the trend towards increasing percentage is concerning. And I do believe, you know, whatever you call, whether it's the first wave or the second wave, there is, you know, we never really plateaued down to where we wanted to be, and it is starting to tick up. That's the concern.
It is a concern. And Dana, yesterday KDHE added some states, including Alabama, to the quarantine list because of an increased number of cases. Thoughts about that?
Yeah, I mean, it's certainly concerning. Again, we know the virus is out there. We know there were many cases, even during the lockdown. We knew as we were reopening, when you have more people who are susceptible, since the virus is out there, you know, if you think about it, it probably started with one person in China and has now gone global. We know that it spreads very easily. We know that it continues to be out there, and when there are susceptible hosts, it will find the host. So I think that the percentage positive is certainly concerning and scary. And that's, again, just the people that we are testing. And just think about all the people that we've known about when there hasn't been testing available that we suspected that were infected and the virus was spreading in that manner. So 14%, it could certainly be higher. Hopefully, as we are able to get more and more testing out there to the general population, we'll get better numbers. But yeah, 14% is very concerning. Yeah,
that one makes me nervous. So I think that early on there was mask shaming, as Dr. Nawalnik, our psychologist here a few days ago, was pointing out. There was mask shaming if you didn't wear a mask. Now there seems to be mask shaming if you have a mask on. But some states are beginning to relook at those criteria and thinking about requiring a mask. What do you all think about that? I'm just turning now to like Mark and Larry. Thoughts about masks out in the public?
Well, I agree with you, Steve. I think that it has dropped off, just in my personal experience and being out and about and going places. A couple of weeks ago, you probably couldn't find anybody out in a retail area that didn't have a mask on, and now my recent experience, less than 50%. Nobody shamed me either way. I've had a couple of instances where I've forgotten my mask and had to go in someplace really quickly, but it is a little concerning that practice, at least, appears to be dropping off a little bit.
Yeah. Thoughts about that, Mark? I mean, in the city, what are you seeing?
Yeah, no, I think I agree with Larry that I'm seeing the same thing. It seems like there's been some drop off in the number of people wearing masks, depending on where you go, and clearly don't think that's a good thing.
It's tough.
And I would like to add, too, I'm sorry.
Go ahead, Hawk.
In regards to the mask, we know that there are things, there is proven now and good data to support things that reduce transmission and infection. And these are physical distancing, proper hand hygiene, and really mask wearing. Even in the household now, there are publications that have shown that doing those things significantly reduces spread of the virus. There are other reports now coming out about, maybe a certain blood type, you're less susceptible to severe infection. Going around on social media before, there were talk about certain ethnicities or cultures not being susceptible to the virus. But it's so amazing how those things take hold, but yet the things that we know are proven aren't really catching on or have not continued to take a hold, such as mask wearing.
Yeah. Well, that's because the internet medical degree carries a lot of authority, I guess. I'm not sure about that. Sometimes that's how it goes. Jill, do we have questions from media this morning?
Yes. Hello?
Hello.
Hey. Hi, good morning, everyone. My name is Bryant Madrick. I'm a reporter anchor at 41 Action News here in Kansas City. Had a two-part question, but the first question was in regards to recovery. I was curious about the quality of recovery, because it seems the story is different for everyone naturally. Some people recover and they're just fine. Other people, depending on how long they're dealing with coronavirus in their battle to get healthy, there could be some long-lasting health effects. And I just wanted to see if someone could talk to me about some of what the new health challenges may be for people who recover from coronavirus a little longer than others.
You bet. And let's take a couple of different perspectives, because I think we have representatives from hospitals that have different populations. Mark, what are you seeing over at Truman?
In terms of recovery?
Yes, sir. How is it going for different patients, and how are people doing as they recover? And
yes, I'm not that close to that, but as far as I know, I think that people have done pretty well recovering. I'm not aware of any folks that have had a lot of lingering symptoms.
I bet. So, Dr. Adiga, up in Liberty, as an infectious disease doc, what are you seeing with some of the recovery, the trajectory?
Yeah, I think it depends on the patient first, because there are two distinct kinds of patients that we're dealing with. Some are otherwise healthy, relatively young patients who get ill, whether they get hospitalized or managed as outpatient, and the other category is older patients or with a lot of medical problems. In both of these, we are seeing prolonged recovery time. In the first category, I think they seem to recover a little bit faster, while they do have annoying symptoms, but they are not limiting their function as much. But in the second category, it is taking a long time that I see, even to time to discharge. Any other complex medical problem, we tend to be, able to easily discharge them within a week. That would take, over 2 weeks, 3 weeks sometimes for hospital discharge. And even after that, recovery in a long-term care facility or some other assisted facility is being needed for their functional recovery. So that is taking months. It is true that this disease is causing a pretty, longer recovery period for people who survive.
Yeah, that's been tough. And I know that Hawkeye, when you're watching, you're on the floors a lot, you've seen a lot of patients and seen a lot of people back in clinic with this. There is this population that seems to have this kind of long, stuttering course. Hawk's trying to drive and talk at the same time, and maybe too much for him. Let me talk about it for just a moment, because I know we've had a few people who have come back, and they didn't have to. We had a couple of folks. Yeah, there you go. I was going to say, I know we've had a couple of people who've actually had to be readmitted because of their symptoms. Ed, Hawk, are you there? He's in between cell towers. So I know we've had several patients come. I think that what Dr. Adiga said is really right. There are a couple of different trajectories toward recovery. There are the folks who kind of recover. Well, first of all, there's the folks who are barely symptomatic. And then there are people who have a mild case of what feels like a cold, and then they recover. And then for the folks who come in the hospital, there are those who are here for about 7.5, 8 days. They go home. They do pretty well. But remember, a bad case of influenza can take 8 to 12 weeks to feel better from. So don't be surprised that it's going to take a long time to feel better. And if you were hospitalized, you've had a bad case. It may take 8 or 12 weeks. For the people that go in the ICU and have to be on ventilators, you're talking months. We know that critical illness, if you've been on a ventilator, will often take 6 to 12 months to feel better from. You have to get nutrition right. You got to get your conditioning right. You got to get your musculoskeletal system right, your neurological system right. All those things are askew if you're on a ventilator. So it just assume that it's going to be a long road to recovery if that's it. That doesn't mean you're not going to recover. It just means it's going to be a long road to recovery. So be prepared for that. And I think there are very different trajectories, mostly depending upon the severity of the disease and often depending upon how many chronic underlying conditions you have and whether or not those conditions make it harder for you to recover. So if you got underlying heart disease, it's going to be a bumpier course. That also may limit your recovery because you can't exercise as well or as much. Same thing may be true for COPD. So those things all affect the course significantly. Then, as we've heard before, we had some folks on from Children's Mercy last week or the week before that, talking about the cases of the Kawasaki-like illness, which is an inflammation of blood vessels, especially affecting the ones in the heart, that can cause heart disease, even in young children with otherwise normal heart vessels. So those are the cases we have to think about, because this virus can act in very evil and devilish ways, and it can really cause some significant injury to our bodies. You have to be patient. You have to try and do all the things you can to be healthy in the interim to help yourself recover. So different trajectories out there. Other questions?
Sorry, can you hear me?
Yep.
Hello.
I think we're moving on, Dr. Hawk.
Okay. Well, I was just going to say that I have seen several patients this week in clinic when I was there, and, it just ranges from 84 with heart disease and diabetes who had it and was hospitalized for 2 weeks, who was still positive at 84 days out, but really after his first 7 days in the hospital was feeling good, to the young patient we had who was re-hospitalized with continued symptoms and continues to have symptoms. So I agree, it just varies from person to person, and we don't really know the hows and whys, and I think we just got to continue to treat every patient specifically, look at what they feel and encourage them to continue to keep exercising and getting better and on the path to recovery.
You bet. All right. Other questions from media? Jill, I bet we have questions out from the public.
Yes. Alex wants to know, can you explain why you have to wait 8 weeks in between donating blood?
Okay, here we go, Chelsea. You have to help us explain, why is it 8 weeks between donating blood, especially when we need it so badly right now?
I am very aware right now that I'm on a call with 4 medical directors. So you guys can talk this a little better than I can. It's an FDA regulation. So we require the 8 weeks in between a whole blood donation so that your body can recover and you can adequately regenerate all of the red blood cells that you've lost.
Yeah, I think that's really it. It's red cell turnover time and how long it takes you to replace the blood that you lost. And I think that's really an abundance of safety. And I think there may be some other historical reasons back when people could donate blood for money and they would donate it too often. So I think there are some other things out there. But the real thing is you just got to get your red cells generating. And it takes, the average length of a lifespan of a red cell and how quickly your body can produce that blood.
Jennifer asked, is it inevitable that everyone is going to get COVID? And if so, how do we prepare our bodies for that? What we can do to be healthy?
To stay healthy. Mm-hmm. All right. So that's a great question. Is everybody going to get COVID, Dr. Adiga?
Well, if we don't have a vaccine and if we let this go for a long, long time, eventually, yes, but hopefully not. Obviously, the whole goal of trying to control this pandemic is to not let that happen. And I think, as you know, the herd immunity is talked about when you get about 60, 70% of the population having antibodies, either from infection or from vaccination. So our goal is to limit the number of infection and to get that, immunity through vaccination. Yeah, so that's the goal. Right now, again, the population incidence is well below 5%, usually about 2% in most of the population around us. So we'll see what happens.
Yeah, I'm hoping for that herd immunity. Dr. Botts, what can people do to stay healthy? You and I are both lung guys. I bet we have some strong opinions about that.
Well, I think so. I mean, I think that you just have to use common sense in what you do in keeping yourself healthy every day. Good nutrition, making sure you get a lot of rest, and that allows your immune system to be ready for the onslaught if you do get infected. Certainly keeping active, making sure that your heart and lungs are in good condition, good exercise, even if it's just walking. All of those things, I think, will prepare you better for the infection if you do happen to get it.
Yeah, and if you have chronic health conditions, make sure you take your medications, keep them under control, get your blood pressure down. And, just as a thought, smoking may not be the best therapy for COVID-19. So just saying, if anybody's out there that still thinks smoking is helpful, or vaping, both of those are probably not true. It may be thoughtful just to try and see if you can cut that back just a little bit. I'm a lung doctor. I can't let that one go. Jill, next question.
Lara is a hairdresser. She wants to know, are goggles and a mask enough, and should she use a blow dryer?
Oh, the blow dryer. Hawkeye, are you out there?
I'm here. I think I got good coverage now.
Okay. What do you think about blow dryers and the things that folks who have to deal with haircuts and hair salons and things like that? What can they do to stay safe?
Yeah, I think the best anecdotal evidence we have right now is definitely the masks. I'm never going to not encourage some sort of eye protection, especially if you're close to people. The blow drying, it's really hard to say one way or the other. Certainly, if most people will have masks, the client and the stylist, it's probably going to be for a short amount of time. I don't know. There's probably a little bit of risk there. If you are blow drying, you're probably dispersing any virus. You're decreasing the concentration. That's always a good thing. So I think there's different ways to go and different ways to look at it for sure.
So here's my thought. The closer you are, the more danger you have. We recommend mask and goggles in clinic. And I would say to you that being that close at a hair salon feels a whole lot like a clinic encounter to me. And I think if you can wear goggles and see, my gosh, I would wear goggles and see, especially if I turn on a hairdryer and started blowing stuff around. So I would say goggles are great. They are definitely an adjunct because we do know that the virus can be spread through the mucous membranes around your eyes. So I encourage that. When I went to the hair salon to get a haircut recently, I believe I brought a pair of goggles for my stylist because, with all my hair, I needed a stylist to help that. Actually, that's not true. Been seeing the same person, Tennyson, if you're out there, good morning. Been seeing the same person for a few years, like about 20, and not so long ago, she looked at me and she said, I can't charge you full price for a haircut anymore. All right, Jill, next question.
Magna, she lived in Europe in the 80s, not England, and she's been told she can't donate blood because of mad cow disease. Is that still true?
Chelsea, mad cow disease. Can you donate blood? Or are you mad forever?
So good news on that front. The FDA in, I believe, late April actually issued new guidances regarding several things, and that includes mad cow disease restrictions. It takes a while for blood centers to get all of our systems changed, to get staff trained. It's a pretty big change to make, but actually starting in July, donors who were previously deferred because they lived over in Europe, maybe on a military base, or they lived, I can't remember the exact years, but it's like in the 80s. If you lived there, you are now eligible to donate blood in the United States as of July. So if you come right now, if you come this week or next, we're still going to have to defer you, but we'll ask you to come back starting in July.
All right, so it sounds like mad cow disease is something we can get past now. That's great.
Yeah, it is great.
The virus has mutated to become less deadly. Is that true?
Dr. Adiga, I know you're going to have to pop off here in a minute. Help us with this one, though. Is the virus becoming less deadly, or is it just there's different presentations of it because of underlying disease, et cetera?
I wish I could answer authoritatively because there are no studies to really tell us yet whether the virus is mutating and becoming less less lethal. But on the other hand, I think some of the data comes from increased testing. We are detecting less symptomatic patients. So at the baseline, you do have a higher number of less ill people. So that can also give you an impression that the infection itself somehow is less lethal. So we have to be careful about that. I think the data is still out.
Mark, do you know what the overall mortality rate is looking at Truman? Have you all seen trends one way or the other? Are people doing better, not doing as well? How's it going there?
In terms of mortality?
Yes, sir.
We've only had really a handful of deaths in total, and the bulk of those were early on. So fortunately, we have not. I don't know that we've seen enough to identify a particular trend.
Yeah. Here's what I would say about that virus becoming less deadly thing. I'm not sure that we know enough, as Dr. Adiga said, I'm not sure we know enough to know that that's true. What we do know is this. The early outbreaks tended to be in nursing homes. And that's an older population that isn't going to deal as well with this infection. And because of that, there were more hospitalizations from the nursing homes, which led to a little more mortality early on and a longer length of stay in the hospital. Our early on length of stay was about 13 and a half, 14 days. Now we're at 7.5 days, but the average age has gone down. So we're seeing more people admitted to the hospital, but they're not staying as long. And I think the difference is we've shifted populations of folks being infected. I think the nursing homes and care communities have done a great job of being able to keep people safe, and that's made all the difference. What's also interesting that if you look at prisons, there have been a lot of positive cases in a number of clusters, but again, a little younger population in general, and so tend to do a little better. So there's just a lot of information out there that would suggest that the real change in the viral behavior isn't that the virus is mutating, it's just getting into different populations, and I think that's probably what we're seeing. Jill, next question.
Ashley says she has kiddos whose friends are traveling. When those kids get back, should she keep her children away for 2 weeks or 3 weeks? And that's based on you're talking about Memorial Weekend events.
Yeah, you bet. Hawkeye, what do you think? You're the traveler right now. How long do you have to stay away after you come back from Colorado?
Yeah, well, right now, with KDHE mandates, Colorado is not on that list. I think it depends what state you live in, and any mandates from there is going to be the biggest factor in that. In addition, now we've talked about this. There's a little bit more data coming out that maybe children are not, number one, as susceptible to the disease. They certainly don't get the same symptomatic course as adults for the most part. And number two, maybe less infectious as well. And so I think when that happens, just understand those facts and kind of make your decision based on that. I don't think there's any really other good guidance as far as keeping children away from each other. We still need to continue to physically distance as much as possible. But in regards to that question itself, I think taking into account the possible less susceptible and less infectivity of children, and then again, where you're living and if there's any mandated quarantine when coming from other areas.
Yeah, I think that's right. It's so much. Well, Jill, time for one more question before we wrap up.
Jennifer writes, are you recommending that patients with lung conditions like me physically distance from their own family members? We don't go to dine out. We do allow distance hangouts on patios. What's your advice?
Dr. Botts, what are you thinking?
Well, that's a tough question. I think that from a standpoint, anytime that you can easily practice social distancing, I think it's a good idea, and certainly even amongst family members, I think that's if it's possible, if you can be outside, if you can distance yourself when those susceptible individuals who have underlying conditions, for those people, I think it probably is important. You can't, in some situations, do that. It's hard to do within a household, but certainly for individuals in your family who live not with you or in the same city, perhaps, that you do see, I think still social distancing is probably a good idea.
Yeah, I think that's probably right. And, we talk about the bubble a lot. Who's inside our bubble, who's outside our bubble, and how much risk you're willing to entertain and what your age is like. All those things make all the difference. Well, as we wrap up the day, first of all, let me turn to Chelsea. Any final thoughts today? And thanks again for being with us, and good luck on that blood drive. I'm going to see if I can drag a few family members over with me on Saturday morning to the one off Main in about 31st or so here in Kansas City.
Yeah, that'd be great. Do it. Thank you for having me, first of all. It's always a pleasure to be on here with you guys. But I think I would just leave you with, again, the need is incredibly urgent right now. Blood donors literally save lives. This isn't just something that we throw out there lightly. Oh, you're saving a life. No, you really are. And when our blood supply is this low, it's alarming to the entire medical community to see shelves. So we just implore you to hear this message, and we know that it's a little bit less convenient to donate now because we don't get to come to your company and host a blood drive there. We don't get to come to your church and host a blood drive or your school. We need you to come to us. It's a civic duty at this point to donate blood, and we just hope that people hear that and respond.
Yeah, and I think if you have any doubts, you can go to your website and find out, but we really need you, folks. And then you've heard us say before, BKC, you flatten the curve, help us raise the curve of the Community Blood Center. That is so important. Dr. Steele, final thoughts today.
Well, I just wanted to say that since we're a level 1 trauma center, we're obviously very reliant on the blood supply, and so I wanted to add my shout out to support the call for blood donations. And in fact, as soon as I get off the call, I'm going to call and sign up for a donation myself. And then also just want to thank you again for having me on the call, and certainly want to support social distancing and people wearing masks. We're a big believer in masks, and in fact, we We had a project with the Kansas City Public Library where we were giving masks away, and so I think that's really important. And I don't know if you may have previously talked about the Great Clips incident in Springfield where the two stylists were infected and were taking care of 140 clients, and none of those got infected. So I think that's another sort of testimony of the importance of wearing masks.
You know, I meant to mention that. I'm glad you brought that up because that is really important. That is the story, right? If you wear the mask, you're going to be a lot safer. Dr. Botts, any final thoughts?
I just would echo all of that. I think that we need to continue to be vigilant, and this isn't going away. And if we can continue to have it be so that it doesn't overwhelm us, I think that's the way to go. Masks, hand washing, and just social distancing, I think, needs to be continued.
You bet it. I think that's right. I'm going to assume, Dr. Adiga, just to check, are you still on? I know you had a hard stop at 8:30, but I want to make sure in case you're here. All right, not hearing. You know, Kansas City is blessed by a great medical community, and we're so thankful that Dr. Steele, Botts, and Adiga were able to join us today. Thanks, y'all, and continue the great things you're doing in your hospitals. And it's a delight to work with all the chief medical officers across the community. We have a call this afternoon, so we'll be sharing even more information. Hawkeye, how is it on the road? You doing all right?
It's good, yeah, just in a little bubble, and we'll continue to be physically distanced, and we'll also try to send along some helpful videos for anybody else that may be traveling soon.
All right, well, good luck. You stay safe. We'll be happy when you're back here in the studio. Hey, tomorrow, U.S. Senator Jerry Moran, who's also the chairman of the Senate Veterans Affairs Committee, and Dr. Richard Stone, who's the executive director of the Veterans Health Administration, they're going to be here talking about the reopening, or they'll be on the line talking about the reopening of the VA hospitals in preparation for any type of a second wave. And Senator Moran will also have some other updates. So really encourage you to be a part of that. I think it'll be a great program. Hawkeye will be with us on the road, and we'll have some fun and hopefully get some information out that will benefit everyone. As we wrap up the show today, it's kind of a special thing. You know, we've been asking for you to send us some photos, and some folks have. And Shirley, who has watched this photo, or watched our program every day, sent in a photo with the caption, "Staying safe in the country." That's her puppy Nikki in the picture. Shirley wrote to us that three of us, based on the knowledge gained from this program, have made a decision to postpone a Rocky Mountaineer Canadian train trip. By the way, I want to do that train trip. That would be awesome. From August 2020 until August 2021. We are all 78 and feel we have done the right thing for protecting our health. The trip had involved airport layovers, a train, and a bus, and too many hours in enclosed spaces. Thank you for the broadcast. Thank you, Shirley, for the choice you made. You know, again, it's all about a decision that we make around our personal risk tolerance and what we do and don't do. But as we enter into risk, remember that risk comes back home with us. And so I think it's a wise choice on something like that to stay home. So remember to send us photos of staying safe, especially those wearing your mask and socially distancing, so we can send to others. What a great picture a few moments ago of that child that was sent to us. So thank you all very much for being a part of our program today. We look forward to hearing from you tomorrow. Again, a great program. And remember that wherever you go, whether you're on the road to Colorado, even if you do take a train trip to the Rocky Mountains in Canada, whether you're just going to the grocery store, the infections, oh boy, the pillars of infection control stay with you. And if you follow them, they really help you stay safe. And in the meantime, just remember the same thing we always end with: there's no place like home. We'll see you tomorrow.